So yeah, we will begin with a prayer. So let's request Ashley to pray. We will request another one. Hazel, can you please pray?
Yes, ma'am.
Okay.
In the name of the Father, the Son, and the Holy Spirit. Amen. Lord, thank you for this evening. Please be with us throughout our whole presentation that we may impart knowledge and information for MJ's mom and help us learn and share together so that the wonderful world you have made becomes more beautiful each day. In the name of the Father, the Son, and the Holy Spirit. Amen. Thank you.
Amen. Thank you very much, Hazel. Okay, so we will begin with introduction. Mommy, I'm sorry, but I forgot your full name, Mommy.
Feby Alvarado.
Okay. Where are you saan po kayo dyan sa Pilipinas?
I'm from Leyte.
Leyte. Malapit po pala tayo. Ako po sa Calbayog.
Cebuano
Pero
speaking.
nandito po ako ngayon sa Thailand.
Okay.
Kamusta na po dyan?
Okay naman po. MSCQ pa rin.
Busy daw po kayo
Oo, sa missionary.
Maganda po yung inyong missionary. Kamusta naman po ang nararamdaman nyo ngayon?
Eto, medyo masakit yung likod ko. Gawa ng... I was gardening yesterday. Medyo nakapagbuhat ng medyo mabigat.
Oh, yeah.
Naghakot ng soil.
Naano niyo po ba, nakapa-check up na po ba kayo ng inyong kondisyon?
Way back when I was second year high school in Calbayog Clinic.
Oh, matagal na.
Dr. Varuna.
Oh, okay. Oh, yeah. Parang familiar po sa akin yung apelidong Varona. Ano pong finding sa inyo?
Yun na nga, may scolio ako sa right part.
Ano pong ano pong ilang degree po?
Hindi ko masyadong absorb because my sister was also a nurse in Calbayog Clinic at that time. So, Dr. Baruna was talking to my sister.
Okay. Mm-hmm. So today we will, but you have idea, not, Mommy, about your condition, right? You have. Okay. So today we will just maybe some you will be able to learn more, or you can also share whatever you know about your condition. So, but we will present first. Then after that, you can, do you have the red and green green, enjoy? Yes.
Yes po.
Okay, so if you understand, Mommy, if you don't have any question and you thoroughly understand the topic that we have discussed today, you can raise your green. But if you have question, you can raise the red. Okay, Mommy? If you have clarification, you will try to to answer your question. Okay? Okay, so let's begin. Okay. Our topic is handling scoliosis. Okay. Our goal is to teach and help clients obtain optimum body movements and alleviate pain. I cannot see that. Introduction. Scoliosis is a deformity in the spine that causes an abnormal C-shaped, one curve, or S-shaped curvature, two curves. The spine is not straight but curves to one or both sides. There are three types of scoliosis depending on when it develops. Infantile occurs from birth to 3 years of age. Juvenile scoliosis develops between 4 and 9 years old of age. Adolescent presents between 10 years and when growth is complete. Adults can have residuals of childhood scoliosis. Okay, this health teaching will help our client understand what parts of the spine are involved, what causes and symptoms of the condition, what types of scoliosis based on age and curves, what treatment options are available, what are the consequences of the scoliosis if not treated, what are the do's and don'ts for people with scoliosis. So these are the main topic that we're going to learn today. Okay, mommy? Are you
Okay.
okay? Okay, so what parts of the spine are involved? Okay, so the human spine is made up of 24 spinal bones called vertebrae. Okay, vertebrae are stacked on top of one another to create the spinal column. The spinal column is the body's main upright support. When viewed from the side, the spine forms three curves. The neck, called the cervical spine, curves slightly inward. Okay, the thoracic spine curves outward. The low back, also called the lumbar spine, curves slightly inward. When viewed from the back, the vertebrae form a straight column, keeping the head centered over the body. Each vertebra is made of the same parts. The main section of each vertebra is formed by a round block of bone called the vertebral body. Each vertebra increases slightly in size from the neck down. So going to from the neck down is it becomes bigger. It increased size helps balance and support the larger muscles that connect to the lower parts of the spine. So basically, it looks like this. This is the normal curves of the spine. In the side view, it will look like this. It's like it has a curvature, no? Cervical curvature, thoracic curvature, and lumbar curvature. And when it's on your, if it's on, you're looking at the back, okay, it will look straight. Okay.
Okay. So good evening, Mrs. Alvarado. My name is Mr. Bailon, and here I'm going to teach you or tell you about the importance of the spinal curves. So one of the most common misunderstanding among chiropractic patients is that a healthy spine is one that is straight, which is what mom said earlier, that it is not straight. Any chiropractor will tell you that this is far from the case. The truth is that an ideal spine has a healthy curvature from the top to bottom, precisely a S curve. It is because of this curve that the spine can properly serve as the fundamental center of our equilibrium and stability. So the importance of spinal curves is balance is vital, and spinal curves assist us in standing upright. It becomes difficult to stand up straight if either one of the curves becomes too wide or too small, and our posture becomes unnatural. All right. So the spinal deformity refers to the abnormal curvatures of the spine. As you can see, the curvatures of the spine are either kyphotic or lordotic. There are four types of spinal curvatures in a normal spine that are critical for balance, flexibility, and stress absorption and distribution. As you can see in this picture, this is what a kyphotic curve looks like. So it should be like this. And a lordotic curve is like this, which is in your bottom. So that's basically the importance of the spinal curves, and I will give it to Ashley about talking about the causes of scoliosis.
So, neuromuscular scoliosis is caused by a disorder like spinal bifida, cerebral palsy, or spinal cord injury. These conditions sometimes damage your muscles so they don't support your spine correctly. That can cause your back to curve. Adult scoliosis and kyphosis can be caused by age-related wear and tear of the back or complications from past surgery. Moderate deformity occurs when the facet joints and discs deteriorate over time and are no longer able to support the spine's normal posture.
So, Mrs. Alvarado, now that I have talked to you about the importance of spinal curves earlier, Can you rate for me 1 to 10 the importance of the spinal curves from 1 to the lowest and 10 to the highest?
Sagot ko kung 1 to 10. Ano? Importance. Ay, paano ba? Sagot lang. Sagot lang. Ano? Repeat, sabi ko repeat. Can you please repeat?
Can you rate for me po the importance of the spinal curve from 1 to 10?
10.
10. Okay, very good po. So, as I said earlier, for the kyphotic curve and lordotic curve, do you know the difference from the picture earlier that I showed?
Kani ba?
Okay po. All right.
Yes.
All right. Thank you po. So now we will talk about the symptoms of scoliosis. All right. So
Okay.
the symptoms of scoliosis is a minute. Okay, so the vertebrae in your spine are small bones that are placed on top of each other. It has a natural curve that makes it easier to bend and move. Your spine bends more than it should if you have scoliosis. It takes the shape of a C or S. So the curve is usually mild and has no effect on your appearance or health. However, it has the potential to deteriorate over time. Back pain and other health issues are also possible side effects, which you said earlier you're having now, Poo, right? So back pain and other health issues are also possible side effects. Scoliosis affects both children and adults. It is a condition that certain children are born with. In most cases, the cause is unclear. Adults may also develop it in later in life. So you said earlier, Po, that when you were a teen, you developed the scoliosis, or okay, Po. All right, thank you for your clarification. So when a child is between ages 8 and 10, which I'm pretty sure, I think when you got it, uh, they develop this disorder. As the symptoms progress, they can become more serious. Scoliosis affect every child differently. Some people do not have any signs or symptoms. The others signs of symptoms are their shoulders are two different heights. Their head does not look centered with the rest of their body. One hip is higher than the others or sticks out. Their ribs are pushed out. When the child stands straight, their arms do not hang down straight next to their body. And when they bend forward, the two sides of their backs are different heights. However, for the symptoms of scoliosis symptoms on adults, this condition has affected some people since they were adolescents. And here, I think this is when you got it. So curves can grow over time. Grown-up scoliosis is another form of scoliosis. The bones and joints in your spine deteriorate as you grow older due to wear and tear. The discs that lie in between them begin to degrade. The discs begin to lose height and tilt. Because of this, your spine will bend as a result. Back pain is often as the first symptom of scoliosis in adults. The pain may be caused by backbone damage rather than scoliosis. When the spine bends, pressure is placed surrounding nerves, resulting in symptoms such as fatigue and numbness. So the following symptoms for adult that you may notice is your uneven shoulders or hips also, bumps in the lower back, numbness, weakness, or pain in the legs, trouble walking, trouble standing up straight, tired feeling, shortness of breath, loss of height, and bone spurs that are bony bumps in the joints of the spine from bone and joint damage, and feeling full quickly while you eat. This is because your spine is putting pressure on your belly. So, Miss Alvarado, as I told you about the symptoms in adults, are you experiencing any of this?
Yeah, almost all of it.
Almost all of it po, di ba? So, can you describe to me your scoliosis po again? I just want to clarify po.
See. Nung una kasi, I felt numbness and pain on my right part, upper part
Mm-hmm.
of my back. That's when I told my sister about it.
And I visited her at Calvayo Clinic. That's why Dr. Varona was able to check me up about it. Then the advice of Dr. Varona is for me to have surgery so that metals or anything will be put in it in order for my spine to be straightened. But since we don't have money at that time because we are 10 in the family, 10 siblings, and we are 6 at that time studying at our school in EVA, so we cannot afford for
Understand
operation.
po. Okay, thank you, Miss
And
Alvarado.
I was also afraid, so I'd rather not have it.
Opo, I understand po. Okay. Thank you po, ma'am. All right, Miss Hazel, you can go now.
Good evening po, Mrs. Alvarado. I am Hazel, and now let's move on to the health-related problems and scoliosis. So the most serious issue associated with scoliosis is pain. This pain may be continuous or sporadic, mild or intense. The most serious risk for adult patients is degeneration caused by scoliosis. So since scoliosis alters the alignment of the body, it often causes hip degeneration and pain. This pain, like most types of degeneration, can worsen as the patient ages. Hip pain isn't the only form of scoliosis-related pain. If the curvature puts tension on the spinal discs, nerves, muscles, or ligaments, it may cause back pain and sciatica. Pain in the legs or buttocks is more common. These pains, which may also manifest as trembling or difficulty balancing, are normally caused by compressed nerves, which occur as the curvature worsens and the body gradually contorts. If a curve is not handled, it can worsen as a patient gets older. The most extreme curve, the more serious the problem it causes. Since the body's equilibrium is thrown off by a deteriorating curve, adult patients can struggle with their balance. It may also cause a patient's height to decrease. So, scoliosis affects the entire skeletal system, including the spine, ribs, and pelvis. It impacts upon the brain and central nervous system and affects the body's hormonal and digestive systems. It can deplete the body's nutritional resources and damage its major organs like the heart and lungs. In severe scoliosis, where the curvature exceeds 50 degrees, it can cause the spine to rotate, which can lead to decreased lung capacity and heart problems. Rarely, scoliosis is associated with abnormal heart mechanics, such as a heart valve abnormality known as mitral valve prolapse, but it is not clear whether the abnormal shape of the upper body leads to this problem or if the valve and spine both develop abnormally because of a single growth problem. On the other hand, scoliosis results in a restrictive lung disease with a multifactorial decrease in lung volumes, displaces the intrathoracic organs, impedes on the movements of ribs, and affects the mechanics of the respiratory muscles. It also decreases the chest wall compliance directly and the lung compliance indirectly due to progressive atelectasis and air trapping, causing a significant increase in the work of breathing because of the associated respiratory muscle weakness, and it may lead to chronic respiratory failure. So, if scoliosis is severe and untreated, it can cause additional problems including breathing problems, low back pain, persistent pain if there is wear and tear of the spine bones, spinal infection after surgery, spine or nerve damage from uncorrected curve or spinal surgery, and leakage of spinal fluid. So, ma'am, aside po from the ones you mentioned a while ago, like the numbness, ano pa po yung mga nararamdaman nyo bukod doon?
Yung sumasakit din po yung aking hip. I think that last February, nagkaroon ako ng check-up doon sa doctor. Dahil sumasakit nga yun, hirap akong tumayo, hirap akong umupo. Pag umupo ako na hindi tama yung position, super sakit. Tapos, that's when the time na we go to the doctor, me and my sister. And merong merong binigay sa amin na reseta for pain, ano pa ba yung vitamin dyan? Calcium, for calcium
Okay
vitamins.
po. But thank you
And
for that, ma'am.
I forgot. Basta there were three medicines na nireseta sa amin. Good for 3 months.
Okay po.
Three-
So now let's proceed to the diagnosis. Scoliosis is usually confirmed through a physical examination, an X-ray, spinal radiograph, CT scan, or MRI. The curve is measured by the Cobb method and is diagnosed in terms of severity by the number of degrees. But here, doctors may also perform a neurological exam to check for muscle weakness, numbness, abnormal reflexes. We're gonna let you watch a video regarding that.
Ma'am Regine, I think there's no sound.
There's no audio po.
Walang sound?
Wala po,
Wala
ma'am.
po.
Oh,
I think when you share screen po, there's an option if
okay.
you
Saan
can,
po yan?
about your audio.
Saan po yan kukunin?
Hmm.
Share sound, no?
Yes po, ma'am.
Okay. Okay na?
Yan po, ma'am. Meron na po.
Several things to look for when screening for scoliosis include 1. Head appears off-centered between the hips. 2. One shoulder appears higher than the other. 3. One shoulder blade is more prominent than the other. 4. Trunk and rib cage appear shifted to one side. 5. Waist appears asymmetrical. 6. One hip appears lower than the other. And 7. Clothing hangs unevenly. One test your care provider may perform is called the Adams Forward Bend Test. As your spinal curve develops and the spine twists, asymmetry of the rib cage or waist is created. A scoliometer is used to measure the amount of rotation. Trunk rotation is determined with a forward bend at the waist and is a reflection of the severity of scoliosis. A rotation of greater than 5 to 7 degrees suggests scoliosis may be present.
So now let's move on to the types of scoliosis based on age. First is idiopathic scoliosis. It is the most common type, known as adolescent idiopathic scoliosis. It develops between ages 10 and 18. Juvenile cases diagnosed between ages 4 and 9, and infantile cases in children 3 years and under are also possible. Second is congenital scoliosis. It is a rare condition that develops in the womb and lingers after birth. About 1 in 10,000 babies have this condition. Congenital scoliosis is usually corrected with surgery. Next is neuromuscular or myopathic scoliosis, which develops in wheelchair-bound individuals. It's most common in patients with muscular dystrophy, cerebral palsy rather, and other neuromuscular conditions. The fourth one is degenerative scoliosis. It is also known as adult onset scoliosis. It develops later in life when the facet joints linking spinal vertebrae begin to deteriorate. An asymmetrical spine may appear slowly as a person ages, often causing no symptoms and therefore remaining undetected. So now, let's talk about the types of scoliosis based on the spinal curve. First one is thoracic scoliosis. The curve is located in the mid-thoracic spine. This is the most common location for scoliosis to develop. Second is lumbar scoliosis. The curve is located in the lower lumbar spine. The third one is thoracolumbar scoliosis, which is the vertebrae from both the thoracic and lumbar spinal sections are involved in the curvature. Fourth one is levoscoliosis. The spine curves to the left, forming a C shape. This type of curvature most often develops in the lumbar spine. The fifth one is dextroscoliosis. The spine curves to the right, forming a backward C shape. This is the most common type of side-to-side spinal curve. Dextroscoliosis usually forms in the thoracic spine through a second curve in the opposite direction, and it can also develop in the lumbar spine, creating a backward S shape. This is an example of double scoliosis. Next slide, po, so you can see the picture. So you can see in the first one, it is the healthy spine. Second one is the girl with thoracic scoliosis. Next is the one with the lumbar scoliosis. You can see there is a curvature on the lower area. And then the thoracic lumbar scoliosis, you can see middle up to the end. And then the combined scoliosis, it forms an S shape.
Scoliosis is an abnormal curvature of the spine that, if left untreated, can lead to medical complications. In order to understand scoliosis better, let's first take a look at a healthy spine. Small bones called vertebrae align in a series to compose the spine. Ligaments and muscles connected to the spine provide stability while allowing movement. A healthy spine has natural front-to-back curves. The curve in the neck area is called the cervical spine. The second curve forms the thoracic spine located in the upper back. And the third curve forms the lumbar spine located in the lower back. A healthy spine appears straight from a front or back view. Scoliosis causes an abnormal side-to-side curve of the spine. This affects the structure and posture of the rest of the body. One hip or one shoulder may appear higher than the other. The shoulder blades may stick out, and the body may lean to one side. Scoliosis is a progressive condition, meaning that it can get worse over time. If left untreated, a severe curvature can form, causing the vertebrae to rotate and move even further out of position. This can make it difficult to breathe, or cause pressure on the spinal cord and nerves, causing pain and fatigue. So what causes scoliosis? Some people are born with malformed vertebrae, unequal leg lengths, or fused ribs that cause congenital, meaning born with, scoliosis. Neuromuscular conditions such as cerebral palsy, muscular dystrophy, spina bifida, and polio can also lead to scoliosis. In adults, scoliosis may develop because of degenerative changes in the spine, including osteoporosis, a bone-weakening disease, and arthritis. In most cases, the cause of scoliosis is unknown, and this is termed idiopathic scoliosis. Mild spine curvature usually do not require treatment, but are monitored. Back bracing may be used to treat curvatures that are more significant for children that are still growing. Back braces use pressure to strengthen the spine. Physical therapy can help to strengthen the back and improve balance while sitting, standing, and walking. Occupational therapy can help improve independence with daily activities, such as dressing. Therapists can custom order seating systems that provide support and help maintain posture. Surgery is usually required for spine curvature that are significant because of the high risk of medical complications. Spinal fusion surgery is used to correct the curve in the spine and secure the vertebrae together. Children are screened for scoliosis in most school systems, and adults are screened for osteoporosis as they age. Regular monitoring and intervention may help scoliosis from becoming worse and allow the greatest amount of independent activity.
So you've mentioned po a while ago that your doctor recommended surgery. Pero aside from that po, what treatments have you done po or performed before? Or you're now taking? None. Okay po. So let's proceed to treatment. There are 3 proven treatments for scoliosis, which is observation, bracing, and surgery. So your doctor will recommend one of these treatments based on the severity of the scoliosis and the physical maturity of the patient. These features predict how the scoliosis should behave during your child's growing years and as an adult. First is casting. In infantile scoliosis, a doctor may use plaster casting instead of bracing to help the infant's spine grow into a typical position. The cast attaches to the outside of the infant's body and they will wear it at all times. As most infants grow rapidly, the doctor will need to change the cast regularly. The second one is bracing. If a person has moderate scoliosis and the bones are still growing, the doctor may recommend a brace. The brace will prevent further curvature, but it will not cure or reverse scoliosis. The person will usually need to wear the brace all the time, even at night. Its effectiveness tends to correlate with the number of hours per day that the person wears the brace. So the brace does not generally restrict what the person can do. If they wish to take part in physical activity, they can take the brace off. When the bones stop growing, a brace is no longer necessary.
Route 1. Non-operative management. Just like everyone has unique physical qualities and attributes, so does an individual's curve. As a result, there is not a one-size-fits-all solution. Scoliosis can be treated non-operatively or operatively, without surgery or with surgery, and is determined based on the size and severity of your curve. Non-operative treatment options are primarily focused on the size of the curve and amount of growth remaining. For instance, curves between 10 to 25 degrees are considered mild. At this stage, observation is recommended if the patient is still growing. Observation includes visits to a specialist where they will monitor your curve by taking periodic x-rays of your spine. If the patient is no longer growing, no treatment is necessary. Moderate curves are between 25 and 40 degrees. At this stage, patients are recommended to wear a brace. For those no longer growing, observation over the course of 3 to 5 years is the recommended treatment option. Curves greater than 50 degrees are considered severe. At this stage, surgery is recommended for patients whether they are still growing or not. Operative treatment will be discussed more in Chapter 4. In this chapter, we will be discussing bracing as a non-operative treatment option. What is bracing? Bracing is conducted by a bracing specialist, an orthotist, who will evaluate, design, and fit an external support system, or a brace, in an attempt to halt abnormal curves in the spine. How does bracing work? The typical scoliosis brace is made of contoured plastic that fits snugly around the torso and hips. There are a variety of brace styles, some designed to be worn full-time and others to be worn only at night. The biomechanical principles of bracing are founded on evidence that directed pressure reduces the curves and moves the spine into better alignment while the brace is worn. One common question among patients is whether scoliosis bracing is effective. Plainly put, bracing is effective, but occasionally it is not. Research has shown a 72% success rate in stopping the curve progression for patients who consistently wore a brace versus a 48% success rate for patients who did not wear a brace. The same research study concluded 18 hours or more per day is the optimal amount of time needed to halt curve progression. Ultimately, this means that people who consistently wear a brace are less likely to develop a curve that may require surgery. Bracing is proven to be the most effective, non-operative treatment option. Are there other treatment options that will prevent scoliosis from worsening? This is a topic of great debate. Proponents claim a variety of treatments and techniques can prevent scoliosis progression, including acupuncture and acupressure, electrical stimulation, biofeedback, traditional physical therapy, magnets, Scroth physical therapy, chiropractic manipulation, shoe orthotics, and other less traditional treatments. However, currently none of these methods have evidence to prove their claims. Ultimately, it is the responsibility of the patient, parent, and the physician to determine the best course of action and treatment method. The treatment approach should be based on many factors, including the degree of curvature, amount of growth remaining, and the patient's willingness to adhere to the bracing program. If bracing is chosen, open communication between the patient, parent, physician, and orthotist is essential to achieving success. For more information about bracing,
So to add an additional information, there are two types of brace. First is thoracolumbocervical orthosis, or TLSO. It is plastic, and its design means that it fits neatly around the body's curves, but it is not usually visible under clothing. So the next one is Milwaukee brace. This type is a full torso brace that has a neck ring with rests for the chin and the back of the head. Doctors reserve the use of the Milwaukee brace for when the TLSO is either not suitable or not effective. So the next slide. The first picture is the Milwaukee brace. You can see that there is a rest for a chin. It goes at the back of your head. And then the next one is the TLSO. As you can see, it is plastic and it hugs your body. So aside from that, we also have chiropractic treatment. Some people visit a chiropractor to relieve the pain and discomfort of scoliosis. Chiropractors manipulate the spine and provide alternative treatments. They maintain the realigning the spine to promote healing and well-being. Chiropractic treatment may improve the quality of life for a person with scoliosis. However, it is not a cure as it does not resolve the curvature of the spine. Research has not proven that chiropractic manipulations have benefits for scoliosis. People who wish to visit a chiropractor should take care to select one who specializes in scoliosis. Receiving chiropractic treatment from a non-specialist can make symptoms worse. The next one would be exercises. Various exercises may help with scoliosis, and experts propose a range of strategies. However, they all aim to realign the spine, rib cage, shoulders, and pelvis to achieve a typical posture. The last one would be surgery. In severe cases, scoliosis can progress over time. In these cases, a doctor may recommend spinal fusion. This surgery reduces the curvature of the spine and prevents scoliosis from getting worse. A surgeon may use metal rods, hooks, screws, or wires to hold a part of the spine straight while the bone heals. They may also use bone grafts to help the bone heal. So I'm now giving the floor to MJoy so he can discuss the consequences of scoliosis if not treated.
So, consequences of scoliosis if not treated. Cognitive effects. Idiopathic scoliosis patients have an alteration in cognitive integration of vestibular signals. It is possible that the severe spine deformity developed partly due to impaired vestibular information traveling from the cerebellum to the vestibular cortical network, or alteration in the cortical mechanisms processing the vestibular signals. Yun, for the cognitive effects. And for psychological effects, most research studies have documented a higher proportion of psychological disturbances such as self-criticism, negative body image, and low self-esteem, and mental disorders such as anxiety, depressive disorders, personality disorders, or among idiopathic scoliosis patients. And for physiological effects, a curved spine often affects the way a child holds his or her neck, shoulders, hips, arms, or legs to compensate for imbalances. In mild cases, deformity is less noticeable and there is less danger to internal organs. Severe scoliosis, if not treated, can potentially affect not only the spine and rib cage, but also may eventually affect the heart, lungs, and other internal organs. Children with severe scoliosis frequently use compensating postures in an attempt to alleviate pain and imbalance they feel in their body. Okay, next, Miss Ashley.
So, dito na po tayo sa do's and don'ts. So, sa first po sa may do exercises that strengthen your core and back muscles. A strong core is the foundation of a healthy spine. Next is, do be active and move. The last thing we want for you is to be immobile, lethargic, or overweight. Don't be afraid that the curve you have will worsen if you move too much. Live your life and start moving. Next is do swim, dance, and play sports. However, this do comes with some limitations, as there are a variety of curvatures that may be present in every individual. Certain movements are a definite no-no to everyone. Before continuing any sport or activities, please consult with your chiropractor or a specialist who can assess the structural and mechanical aspect that comes into play with scoliosis. Next is do chemical testing. Hormonal and nutritional testing should also be done on every scoliotic patient. This is because there will be a combination of nutritional, chemical, and hormonal imbalance in a person with scoliosis. Next, do get a good mattress. Optimally, a person should be sleeping for at least 8 hours a day. This indirectly means that they will be sleeping for at least one-third of their lives. That is a very substantial amount of time. Hence, please start loving your spine and get a good mattress. Next, don't get do get early intervention. A gram of prevention is always better than a kilo of cure. Early detection of scoliosis will go a long way in helping with the treatment. So sa don'ts naman po, don't be a tech addict. Put down those gadgets and take a break from the computer. Bad posture puts a lot of additional load on our spines, causing us to develop a text neck and causing degeneration to occur at a quicker rate. Next, don't lie on your stomach. Lying prone when sleeping increases the pressure on the lower back by a substantial amount. Sleeping on the prone position or on the stomach causes the neck to be in a rotated or twisted position for prolonged periods. Also, the sleeping on the tummy will cause the natural curves of the upper and mid back to flatten out. Next, don't do any back extension exercises. Stay away from any motion or exercise that induces back extensions. Repeated or prolonged extension of the torso causes the extensor muscle to tense up. This may induce more rotation to certain vertebral segments and indirectly a further worsening of the spinal curvature, which may be harder to undo. Next, don't get too much exposure to bright lights during or right before sleeping. The presence of light during or before sleeping will impede the production of this hormone. Next and lastly, do not carry heavy backpacks. Heavy backpacks put an enormous load of pressure on a person's spine. This is very dangerous. The maximal limit of weight of one should carry is 10% of one's body weight. Anything above that is too strenuous on the lower back and becomes scoliotic hazard. May questions po ba kayo sa do's and don'ts? Sige po. Thank you po.
Welcome. Karma. For conclusion, live life to the fullest. Living life to the fullest means taking an active role in your own development. It means steering the rudder of your own life and taking advantage of your unique and powerful potential as a person. To live life to the fullest means to maximize your capacity to experience what life has to offer around you. This, in turn, expands your consciousness, resulting in even more opportunities to have an even broader range of life experiences. If you really want to live life to the fullest, make a habit of always reaching for new experiences that push you to grow. And when you're growing and your growth is having a positive influence on others, you'll know you're truly maximizing your life. Colossians 3, verse 23 and 24 says, "And whatever you do it heartily as the Lord and not to men." 23, knowing that from the Lord you will receive the reward of the inheritance, for you serve the Lord Christ. And now.
Okay, thank you very much. Ma'am, do you have any question, or do you have any comment or any suggestion or any reaction about our report?
Naman, since I have scoliosis, hindi ko pa rin nililimit ang sarili ko sa mga gawain. Kahit ano, ginagawa ko pa rin. Although I suffered pain. Pero nasanay ako kasi sa trabaho during childhood, kaya hindi ako pampante pag walang ginagawa. Makulit pa rin. Nabuboring ako pag walang ginagawa. Kaya yun.
Tama naman po
Suggest
yun.
ko na lang na tulungan siya ni M-Joy sa pagbubuhat
Nasa dus naman
ng
po.
soil.
Tapos yung choose yung sa mattress, na observe ko sa akin, ayokong humiga ng malambot na bed. Hindi ako kampante. Mas gusto ko yung medyo manipis lang na foam, na ma-feel ko yung wood. Medyo okay sa akin yun kasi ma-flatten yung aking likod.
Yeah, likod, okay. Naging helpful po ba sa inyo ang aming health lecture? Health teaching?
Yes po, kasi
marami po ba kayong natutunan?
Naunawaan ko naman. I understand
salamat.
naman. Maraming salamat din po. Ako ang ginamit yung pasyente tonight. Kasi mayroon akong mga information na nalalaman na hindi ko at least hindi ko na masyadong mag-worry kung ano yung nararamdaman ko. Na-absorb ko na lahat. Although some of it na-experience ko kahit this year. This year. That was the worst pain I've ever had. So, ngayon, nag-a-adjust na rin kasi nga, di na bumabata. Thank you so much.
Thank you rin po sa inyong cooperation.
Welcome.
We're glad that we're able to help in a little way. How about other members? Do you have any thing to say to our patient
Um,
today?
so, Miss Alvarado, my recommend for you is just like you said, live your life to the fullest. But as you have your symptoms, I recommend that you may limit it, and because it's for your own health and sake. Yun lang po.
Thank you. God bless.
God bless po,
God bless
ma'am.
everyone.
Ingat po. God bless din po.
Yeah, thank you so much.
Thank
Okay.
you for your time po, Mrs. Alvarado.